Number 169, Partners Healthcare receiving $1 million, representing a savings of $200,000 from whatever the previous contract is. I must thank you for at least achieving a good savings, which actually brings up a question as to when is Runnells actually going to be breaking even or making money. For years it's been losing money all this time. I'm just wondering about that. But thank you for the savings on that.
169 regarding the Runnells Hospital. I appreciate the kind words from Mr. Patterson. I also want to let folks know here that we are trying our best at Runnells to get to the point where we can break even. The state has made it very difficult with the level of reimbursements to match that goal that we have as a field board, and I think that's been a major hurdle that I've difficulty overcoming right now. So we strive to break even, and I think that's the goal we'll try to do up at Runnells. I do appreciate the work of the folks up at Runnells for all their efforts to try to minimize cost of this carrying, maximize reimbursement, and but also at the same time provide the level of service that our customers are getting. I think that helps explain the question or comment on 169.
And number 169, if you could give a more detailed explanation. You're entering into a contract with Partners Healthcare to provide pharmaceutical services to residents at Runnells. You're explaining that it's a $200,000 savings from the previous contract, and it's hard to tell what there is a savings for at Runnells. And this is something, pharmaceutical services. You don't have a pharmacist on staff. Is this in addition to pharmacy on staff? And who exactly is on staff at Runnells? Community County Watchdog Association did a detailed report on your personnel, on how you account for your employee list, and Runnells was beyond strange. You have people that are actually working in other departments. They're on other payrolls. If you're, at the time when we looked into it, you're the Director of Division of Hospital Finance and the Department of Administrative Services had 2 employees assigned to Runnells. So they actually weren't on the Runnells payroll, they were on a different payroll. So when you look at the bottom line and you say Runnells only lost this amount of money this year, you're not really telling the truth because your numbers aren't accurate. So, and I've brought this to your attention before, but there's absolutely no transparency with your Runnells payroll. And we looked at the 2010 employee list. I don't think we revisited it since then, and maybe we will. But maybe you can tell me tonight that that's all been straightened out, and people that work at Runnells are actually on the Runnells payroll. And not to mention, I mean, it's no secret that Runnells is a patronage pit, and this is just one of many services that you contract out for Runnells. So Runnells is a mess. And the numbers that you portray just aren't backed up with facts.
169, call up Administrator Wheeler. Before I have her address, I want to disagree with the speaker about Runnells being gas.
Factual. It's your document.
My comment, Mrs. Renner, you have your chance. Mrs. Wheeler, can you please speak?
Yes. Good evening, Chair and members of the board. Through you, pre-voted Chair. The savings to Runnells of $200,000 is based on our negotiating of reduced per diem rate for all of our residents there that are Medicare Part A, state-funded psychiatric patients, and I can get you a total of patient days. We have well over 100 patient days at the hospital, so any savings that we're able to negotiate for that per diem rate is multiplied by 100,000 days, and I can get you the details for that if you wish me to. This affects the majority of our residents that live with us and our patients on our psychiatric unit.
Chairman, I'd also like to take exception, along with you, Chairman, to the comment made about Runnells Hospital. Runnells Hospital, if we examine the evidence, receives outstanding ratings from every state aid regulatory agency. It is a place where people receive wonderful care. We receive letters from the relatives of patients every week thanking us and the Runnells staff for the wonderful care that people receive there. And to call it anything other than outstanding is not called for at all.
We are working with a cap that allows us to only raise taxes a certain amount of money. We are receiving drastic cuts in funding from the federal government as well as the state. When people talk about Runnells Hospital, we are severely not getting the money that's deserved us. Anybody who's here from Runnells Hospital knows that. That's the state government, frankly, probably to the tune of $4 million a year not paying us what we're supposed to get, which obviously makes things enormously difficult. And I know Joan Wheeler is shaking her head over it because she knows that's true. So I'm saying these are the things that we're dealing with. We appreciate you coming out tonight. I'm sorry for losing my temper a bit, but that's those kind of comments, especially about our public safety people, are totally uncalled for.